Great. Welcome, everybody, and good morning or afternoon, depending on where you're located. And welcome to today's informative webinar, Pathways to Healthcare Coverage, Navigating Marketplace Enrollment. We are delighted to have you join us today as we share essential knowledge about marketplace enrollment with a special focus on addressing the unique needs of your community and patient population. In our increasingly complex healthcare landscape, understanding how to help your community members navigate the enrollment process can be challenging. Today, we are here to help simplify this journey and ensure that everyone has the tools and knowledge needed to access quality healthcare. My name is Liz Best, and I'm the Manager of Technical Assistance with the Technical Assistance Research Center, otherwise known as TARC, here at NCUE. And joining me from NCUE are Molly, Ava, and Sean. We are honored to have you all here today, and we kindly ask that you please place your name, your organization, your tribal affiliation, and title into the chat box. It'll also be helpful if you put your geographic location as well. In addition, we welcome any feedback you might have, and we will provide a link to our survey in the chat as well. Next slide, please. So for those of you who are unfamiliar with NCUE, here's a little background. The National Council of Urban Indian Health, otherwise known as NCUE, is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indian and Alaska Natives living in urban areas. NCUE is the only national representative of the 41 Title V urban Indian organizations, or UIOs, under the Indian Health Service and the Indian Healthcare Improvement Act. NCUE strives to improve the health of over 70% of the American Indian and Alaska Native population that lives in urban areas, supported by quality, accessible healthcare centers. Next slide, please. Today's event is made possible by the IHS Services Co-op Agreement Funds. However, this event is solely the responsibility of the National Council of Urban Indian Health and does not necessarily represent the views of Indian Health Services or the Department of Health and Human Services. Next slide, please. So before we proceed, please note that this session will be recorded for educational and quality improvement purposes. The recording will also be shared both in an email to you and on our website to make it accessible to those who may have missed it or who would like to revisit the content at a later date. Next slide, please. Please note that your mics have been muted upon entry. However, we always encourage participation and engagement in our sessions. We invite all the participants to turn on your camera and post questions and comments in the chat box. There will be an opportunity for a Q&A at the end. Next slide, please. So as we continue, as I said, we encourage active participation and value your questions and insights. To make the most of this interactive experience, here is how you can ask a question in Zoom. Just click on the chat icon, type your question, and hit enter to send to the group. Next slide, please. Our learning objectives for this webinar are designed to ensure that you come away with valuable knowledge to inform your community members. By the end of this session, you will have a solid understanding of the Affordable Care Act enrollment process, including its significance and key provisions. We aim to equip you with the ability to help yourselves and others navigate through various healthcare enrollment options effectively. Our goal for you is to feel confident in mastering the enrollment process from start to finish. Next slide, please. But before we get started, let's have some fun with a knowledge and awareness poll to better understand your perspectives. Sean will launch our poll, and we encourage your participation. Rest assured, your poll answers will remain completely confidential. Great, and we'll give everyone a few minutes to work on the poll. It's 7 questions, and you can just go through at your own speed. Give everyone another minute. Okay, we'll go through the answers. So which cost-sharing plan requires a referral to avoid payment, co-payments, deductibles, or co-insurance when getting essential health benefits? The majority of you got this right. It is limited cost sharing. Second answer, the majority got right. This is true. The only federally recognized tribal citizens can enroll in a marketplace health insurance coverage monthly rather than just yearly during the open enrollment period. The third question, what is your preferred way to relax after sorting through healthcare plans? Seems like the majority of you like to do some sort of yoga or meditation. It can be daunting and tiring. And others love to eat Ben and Jerry's fish food. Number 4, how do you remind yourself of important enrollment deadlines? Most people do set a calendar alert. Number 5, the ACA requires insurance plans to cover preventative services like vaccinations and cancer screenings with no cost sharing. That answer is true. The majority of you guys got that right. Number 6, what is your preferred healthcare superpower for making enrollment easier? I think the majority said time travel to answer future healthcare questions or invisibility to bypass long lines. And then lastly, in which situation can an individual enroll in Medicaid outside of the open enrollment period? The majority of you got that right. It is if they have a life qualifying event. So great job. You guys seem to have a lot of knowledge, and hope that was a little bit fun for you. Next slide, please. Okay, so without further ado, I'm really excited to announce our guest speaker today. We're so pleased that Kristen Bitsui could join us to share her knowledge. Kristen is an enrolled tribal citizen of the Navajo Nation, and she serves as the Tribal Healthcare Outreach and Education Policy Coordinator for the National Indian Health Board, and has been with the organization for over 7 years. Ms. Bitsui provides technical assistance, education, and training on the Affordable Care Act, Medicare, Medicaid, and children's health insurance programs, as well as changes in the Indian healthcare system. She serves Indian country as a national advocate on the importance of outreach and education activities at the ground level to drive the Indian health system and connect consumers to better care. Ms. Bitsui has of experience with Indian Health Service, tribal and urban Indian programs. And with that, please take the mic away and let's give a warm welcome to Kristen.
Thank you so much for that introduction. And I am so thankful to be able to join you as well. And then I'd like to thank Nikui as well for inviting me to do this presentation for you guys. So let's get started here. Go on to the next slide. All righty, keep going. So I wanted to, with all the open enrollment that's happening, that's going to be happening, that's coming up, and being able to have to do webinars and trainings for you so that you guys can be knowledgeable in being able to do these applications for our tribal citizens. And since there's a lot of protections and provisions across the CMS programs, it's always good to get that refresher as well too. And those of you that are beginners, the best way to learn all of these tribal perspectives is that, by being hands-on and learning and reading as well too. So what I wanted to sort of start with was this graph. When you look at this graph, it makes you wonder how things are happening with our tribal citizens when it comes to the marketplace enrollment. When we first started way back and we started learning about the ACA, started implementing the enrollment, and it was hard. It was really difficult to get our tribal citizens to understand that this was also an option for them at the time, because a lot of times they think that they are that the federal government is supposed to provide free health care on all levels. And so when we ask them to apply for any kind of CMS programs, then they start asking, isn't this supposed to be a free? Why are we doing this? And slowly, as we start educating more, doing more outreach, we noticed that the numbers started going up. And if you look at this graph from 2017 all the way to 2023, the biggest jump, as you can see, is between 2022 to 2023. But when you look at it before COVID started, and the year it started was in 2020, so it was at 50,000 at that time. And then all of a sudden, now in 2023, we look at 66,000. And that's probably due to all of the individuals that had to get referred out of the IHS facility. And a lot of times our tribal members are thinking that they have IHS and they have purchase referred care. But, of course, those that move to the urban side of it don't have that purchase referred care to lean on as well too. So it's sort of interesting how the trends have happened and what happened between 2020 to 2023, and hoping that this keeps going as well too for our American Indians and Alaska Natives, that they understand that this is an option if they are not eligible for Medicaid. So let's go to the next slide here. So here's the streamlined application. So when we talk about streamlined application, those of you that are in the federal facilitated states, those individuals will enroll or do the application through healthcare.gov. And so when each of the states that decided to do state-based may use their own streamlined application, but through healthcare.gov, the application there gets to decide whether by income who's eligible for the Medicaid and who's eligible for the marketplace side of it. That's what they mean by the one-stop shop, and that you get to get that process of doing it through healthcare.gov helps you to determine who's eligible for which program. And when you do it by household, it's really interesting how this happens. And sometimes you might have one could be eligible for Medicaid, could be eligible for CHIP, could be eligible for marketplace, and as well as Medicare too, which is kind of interesting, just depending on where their income level falls and depending on what their age is as well too. So we know that infants and toddlers, their income level is a little bit higher for Medicaid than it is for adults as well too. So good, but it's just interesting how that all happens. But it's good to educate our tribal citizens about this, because a lot of times they think, oh, well, I applied maybe at the beginning of the year and I was told that I was over income, or maybe they applied several years back and they still think that they're over income just because they have a job. But sometimes they're not aware that depending on how many are in their households and maybe how many kids they might have as well, could determine who could be eligible for Medicaid. And you might also have individuals that are reluctant to apply as well too. And this is where we get creative. For those of us that work in this field of trying to educate and to let them know about some of their special protections and their provisions. And so when you look at this whole streamlined application, that makes you think about what that could be. And as you can see, there's many ways to also apply, either online, phone, mail, or in person, for those individuals that go to maybe an urban facility and they have an individual there that assists us with doing their application, or they could go to their IHS facility, or they could go to a tribal facility as well too. And with COVID happening, everything went online. Everything was done not face-to-face. So a lot of our tribal citizens resorted to doing things online. So now we see more individuals that are doing online application as well too. So next slide. So when we talk about streamlined application, one of the things that we have found in the past years is that this question about if you are a federally recognized tribal member or if your family is American Indian Alaska Native, there are two questions on the Medicaid side of it that those that don't get educated about it. So if they go to an urban facility, tribal or even IHS, uh, enrollment assisters are there to help. And a lot of times they might not relate this information to them of how important it is to check mark the box when it comes to the question about being an American Indian and Alaska Native. The only reason why this is important is because this is where the special protections and the provisions and the benefits that are specifically for our tribal citizen comes in play. If you don't check mark either one of those boxes, that means that most likely they're not going to get those special protections and provisions, because we still see a lot of our tribal citizens out there paying for copays, deductibles when they're on Medicaid. On the marketplace side of it, we have those special protections like the limited cost sharing plan, the zero cost sharing plan. That's where those protections are at. So we want to make sure that whether they're applying for any of the CMS programs, that there are special protections and provisions specifically for them. But the only time that will take place is if they look at this question and they answer yes. So either way, it's very important. One of the questions asks if you're a federally recognized tribal member. And if it's a descendant, most likely they're not going to say yes at this point. There's another question on there that asks if they have ever, if they've been, or if they get seen, if they've ever gotten seen at an ITU facility. And sometimes they don't understand that question. So a lot of times, if they're not going to either three of the facilities, sometimes they won't answer it. But the thing is that that question indicates that if you've ever been seen any time in your lifetime, even if it's once in your lifetime, you are eligible for it as well too. So next slide. So it's just a little bit more about the streamlined application and talking about the cost sharing exemptions. I'm going to get a little bit more into this as well too. And then as I had mentioned, what relationship they have with their Indian healthcare provider. And then also asks about certain AIN income and resources. A lot of these are extremely important for those of you that work with our American Indians and Alaska Natives when doing the application. It's extremely important to ask them these questions as well too, and to kind of also know what the Indian income is within your state. Or maybe sometimes you might even have, and of course, being talking to a lot of those that are probably working with urban American Indians and Alaska Natives, they move a lot. So that means that they might be a tribe from Arizona, might be maybe in Virginia, might be in Montana, somewhere else, but they also still get, maybe they use their cultural significant jewelries or anything else that might pertain to that they might be making money off of that. If that is, that's still considered Indian income. So it's good to really understand where that income is coming from. Ask those questions when you're doing the application. So next slide. So here's the timeline. So we know that with all the Medicaid unwinding that's going on right now, we are trying to make sure that a lot of these programs somehow help the individual. If they're no longer truly not eligible for Medicaid or CHIP, then they should at least have something to rely on or to make an option for them. And that's what the marketplace is. So this kind of gives you a visual timeline of what that looks like for you when you're explaining to them and talking about, the special enrollment period. And so since we have a lot of mixed families out there where there's American Indian Alaska Native, maybe married to a non American Indian Alaska Native, then that becomes a mixed family. So you might have a mixture of that as well too. You might have kids that are only that are not enrolled within the tribe, so they become descendants as well too. So then they're not federally recognized tribal citizens. So when that happens, you think about, what is it that we have to know about them? What is their benefits? So that will change when they are not federally recognized tribal member. So a lot of things you have to also understand. So this kind of just gives you that timeline between Medicaid to the marketplace if they do fall off and when that last date is. And of course, that's going to be in July 31st of next year. So next slide. So when we talk about marketplace, we talk about what's all in there. And we know that they are plans, individual health plans. And so, and we refer to them as, private health plans other than Medicaid or Medicare or CHIP. And so within these plans, there is the advanced premium tax credits as well too. And so this helps them to reduce their monthly premiums. So let's say if their premium is showing that it's going to be $500 and they might have an APTC. So if you use the APTC to reduce that, and let's say that APTC is maybe $350. So then their new monthly payment is going to be about $150. And so they can use all of their APTC, or they might be like, no, I just need 300. Let me just use 300 of that. And so that could be the case. And then so 200 would be their monthly premium. So at the end of the year, when they file their taxes, if they don't use all of it, that could be credit back to them as well too. And then there's a cost sharing reduction that lowers the out-of-pocket costs. And so when we talk about those things, we talk about the zero cost sharing plan, the limited cost sharing plan. Those are the two that are specifically for the federally recognized tribal members. So when we talk about the marketplace side of it, it is always about federally recognized tribal members. It's not about the descendants. The only way you're going to be eligible for any of these protections and the provisions and benefits is if they are federally recognized tribal member. And of course, Medicaid and CHIP, falls within the marketplace when you are trying to enroll them through the healthcare.gov. The next slide. So what are the operations of the marketplace? The two main ones are the state-based marketplace, which we refer to as SBM, and the federally facilitated marketplace, which is the FFM. There are some states that have decided that they want to also do a state base, but they want to use the healthcare.gov platform. So what does that make them? That makes them a state-based marketplace federal platform. And so they combine it together is what happens. But they go by all of the federal laws and they go by anything within the healthcare.gov is how that works. But they get to decide on their plans. They get to decide how they're going to distribute everything on the state-based side of it. So next slide. And then what are the categories? So when we talk about categories, we're talking about the bronze, silver, gold, and platinum. And which means that, 60%, 70%, 80%, 90%. And so when we look at those, then we're talking about, well, what about the other part? Where's the other 60? If it's 60%, what's the 40%? And so that's what the consumer pays, and that's what our tribal citizens would pay. If an individual decides to go into the marketplace and they still utilize IHS, if they're within their purchase for care delivery area, then purchase referred care would be able to pay that 40%. That's on the IHS area, or the IHS side or the tribal side, that if they have funding for the purchase referred care. So it's a little bit different when we talk about the urban side of it. A lot of times, most likely they might be outside of the purchase referred care area. So that means that whatever is outside of their plan that they choose, if they choose a silver plan and it's the plan pays 70%, then they will end up having to pay that 30% that the plan does not pay. So it's always good to educate them, to tell them about what that means. I'm going to get a little bit more into the health benefits, not the 10 essential health benefits a little bit later on, but this also plays a part in that. So a lot of times the questions that I always get is that, well, what about the 10 essential health benefits? How does that work in the plan categories? Is, do they have to still pay 70, or the plan still pays 70 and the consumer pays 30? So if they use any of the 10 essential health benefits, that is all paid for 100% by the plan. So this is outside of the plan that is not part of the 10 essential health benefits. This is when we talk about what they would pay out of pocket after that. But if they end up on a zero cost sharing plan, then they don't have to pay anything out of pocket. So when you print out the summary of benefits, you will notice that on the zero cost sharing plan, it's going to be 0, 0, 0, 0, 0, 0. And so, but when you print the limited cost sharing summary of benefit plan, then you will notice that there's 70, 30, or whatever they have out of pocket, whichever plan they decide to choose. So next slide. So who's eligible? So we know that you have to live in the United States. You have to be a U.S. citizen, U.S. national, lawfully present immigrants for the entire time they plan to be on the coverage. At any time, if anything happens where they lose their citizenship or anything that gets them to become lawfully present immigrants, then they're no longer eligible for the coverage as well too. And of course, they can't be in jail. So next slide. And then so premium tax credits, when we talk about that, we want to make sure that they understand how they can qualify for that as well too. So their income has to be between 100% to 400% of the federal poverty level. And a lot of times our tribal citizens that don't deal with federal poverty level, so maybe if they've never been on Medicaid, it has never been explained to them. So a lot of times they might not understand what that means. So it's also good to educate them about that. And so as long as their income falls between 100 to 400% of the federal poverty level, and you also have to let them know that that FPL changes yearly as well too. So a lot of times they might, all of a sudden, maybe their income goes a little bit low for the following year. Always let them know if your income goes down, that's probably a good time to apply for any of the CMS programs. But that's just the basic knowledge about the premium tax credit. So next slide. So a little bit more about premium tax credits. At the end of the year, this is extremely important. At the very beginning, when we started doing education on this and trying to get individuals to understand that this was an option for them to apply for, well, it turned out that we had failed to tell them that at the end of the year, you're going to have to file your taxes, and this is also going to play a part in filing that taxes as well too. And so it's important that they understand that they have to reconcile their APTCs, which is the Advanced Premium Tax Credit. And so anytime there's changes, so it's very, very important. Any life changes, someone moves out, someone got a job, their pay got increased, or maybe even if they are an individual that where their income fluctuates month to month, it is very important that they come back and see you on a monthly basis. because sometimes waiters are a good example, because a lot of times they might not get the same tips every month. And so if their tip goes up high during the season, and then all of a sudden, maybe 2 months later, that's no longer the case and it goes all the way back down. Well, the APC determines that it is determined by the income. So you want to make sure that they understand that they must come back and see you, because you don't want them to be paying back during their tax season. And what else is important on this slide? I think I covered majority of that. So let's go ahead to the next slide. And then there's the cost sharing reduction. So individuals that have income between 100% to 300% of the federal poverty level are eligible for the zero cost sharing plan. And so what this means is that they don't have to pay anything out of pocket. On the marketplace side of it, it's different when we say they don't have to pay anything out of pocket. That means that it's the deductibles, co-payments, and co-insurance. But premiums is not part of the out-of-pocket costs, is what you're talking about, the marketplace side of it. And then for the limited cost sharing plan, we have to remember that I think at the beginning, when those of you that have answered the question about the limited cost sharing plan, which plan is the one that requires a referral? This is really important. Zero cost sharing plan, they don't need a referral to go see an outside provider. And so they're able to also get referred out. So if they go to an IHS facility, a tribal facility, and an urban facility, majority of the time they can get referred outside to another specialty outside of the facility. And they won't need a referral for that. But majority of the time, the practice is that a lot of times the facilities already initiate and they already have a process. So IHS and tribal side have the purchase referred care. If you go through that process, then most likely you're going to get a referral. And that's okay. If they take it with them, that's completely fine. On the urban side, the same thing. If that's the process you have in place already, just let them take it. And, it's also good for the other providers to know where they're coming from and who their provider is as well, too. On the limited cost sharing side of it, you have to have a referral. Just recently, I was at a conference and I got asked, what kind of referral are we talking about? Do they just get a piece of paper saying that, that they should go see this individual? Well, a referral in the sense of seeing a doctor and being referred out to a specialist usually refers to a medical referral. And that's required from an Indian healthcare provider. So the word Indian healthcare provider also means that it's IHS, it's tribal, and it's urban. So a lot of times people ask me too, an Indian healthcare provider, does that mean that it's the doctor from the IHS or from the tribal side? No, that's not. In this sense, that's not what it's talking about. In this sense, it's talking about the Indian health providers, which is IHS doctor, a tribal doctor, an urban doctor. And so in order to avoid that out-of-pocket cost, when they receive the essential health benefits, I'm going to read that again. An Indian healthcare provider to avoid out-of-pocket costs when they receive essential health benefits from a qualified health plan. So there are 10 essential health benefits that you have to be aware of. On that list, you will look at that, and that's how you're going to educate your tribal citizens when you're helping them, is that as long as it fits in these 10 essential health benefits, you don't have to pay out of pocket if you have a referral. I'm just talking about the limited cost sharing plan, because this is very important for you to make sure that you educate those that are going to be choosing a limited cost sharing plan. And so, and the limited cost sharing plan, either one of them, limited or zero cost sharing plan, is available to American Indians and Alaska Native consumer federally recognized tribal citizens they can pretty much choose any plan that they want. It can be the bronze, silver, it can be the gold, platinum, whatever they decide that they want to get on. So next slide. So when to enroll for federally recognized tribal members, they can pretty much enroll anytime through the year on a monthly basis. So they might be like, well, in February, I decide I don't want to be on this plan, and they can disenroll at any time. And then all of a sudden, maybe in September, they decide I need to get on a plan. So they can enroll at that time as well too. The other thing you need to understand about the special enrollment period is that mixed families. If you have a family that is mixed, meaning that there's a non-tribal citizen and you have tribal citizens that are one family and they want to get onto a marketplace plan. If that happens, then they have to be on the same application. They can enroll the whole household on one application. When it's time to choose the plan, it's going to be separate. So those that are federally recognized tribal members will be eligible for the zero cost sharing plan or the limited cost sharing plan. And then those that are not federally recognized tribal member will have a different plan. And you have to make sure this happens. In the past, we found out that sometimes they end up getting on the same plan. The whole family gets on one plan. And for some reason, the system was not recognizing federally recognized tribal members. And so they were not getting the full benefits. And so now we ask, you have to make sure that the federally recognized tribal members are eligible to get onto a zero cost sharing plan or a limited cost sharing plan. The other thing about special enrollment period is that mixed families on the same application, if they stay on the same application, the whole family can be on the special enrollment period, meaning that they can enroll anytime through the year. They can switch plans anytime through the year, but they have to be on the same plan. So let's say that maybe the one of the family members decides, I'm going to go and enroll separately. If that's the case, and they are a non-federally recognized tribal citizen, then they're not going to get that special enrollment period. So that's just something to keep in mind. This is the only time that happened is under the special enrollment period where non-federally recognized tribal members are eligible for the special enrollment period along with the federally recognized tribal citizens. And then as well, through the pandemic, a lot of the open enrollment period had changed, and also the special enrollment periods were even longer as well too. So, but originally it starts on November 1st and it usually ends on January 15th. But you also have to inform them that if they want it to start on January 1st, they have to enroll by December 15th. So next slide. So how do you enroll? Healthcare.gov, or you can go directly to the marketplace plan as well too, but it's better to go through the healthcare.gov for American Indians and Alaska Natives, but you still can go through the marketplace side of it or directly to them. And then the call center is another one. You also have enrollment assisters out there. For those that for American Indians, Alaska Natives, a lot of them are used to going to either an IHS facility, and they're also used to going to a tribal facility. And a lot of times they have their own enrollment assisters there. So the patient benefit coordinators on the IHS side, there's different names when it comes to the tribal side as well, but in some sense, they are enrollment assisters. And then on the urban side, they also have enrollment assisters too. So depending on where they live and what they're used to and what facility they go to, there's always someone there to help them. The good thing about being able to go to either a tribal IHS or an urban um, is that a lot of times they understand the special protections and provisions specifically for tribal citizens. So they'll be able to make sure they check mark that box for federally recognized tribal members. There's also agents, brokers out there that help out with that. And then, of course, there's the paper application, but the faster way to know something or to see if they're going to be eligible for whatever plan it is it's best to go through the healthcare.gov and do the online. And then there are also interpreters. We have seen that several interpreters have increased for federally recognized tribal or tribes. So tribal languages, their native languages. We've noticed that healthcare.gov, SSIO, they have been able to do contracts with interpreters so that if there's an individual that only understands in their own language, you can also request for an interpreter to assist them as well to or answer their questions. And sometimes they rather hear it directly. So it's good to also know that that option is there. And then, of course, there's always help at healthcare.gov. Next slide. And then these are just a call center to how to get a hold of them, customer service representative. Through the years, we have worked hard to make sure that customer service representatives have knowledge. If they don't, then they should be able to refer you to someone that has knowledge about American Indians and Alaska Natives as well too. And if they don't, request for one. And if you run into anything, let me know. I always like to make sure that, if there's something missing or you guys are having challenges, being able to call the call center, then we always want to know about that as well too. As much detail as you could share with me for me to be able to talk to SSIO and let them know what those challenges are. And then the state base usually has their own call center that they create on their own as well. So just make sure if you're in the state-based marketplace to know what those contact information is. So next slide. So we know that there's in-person, and as I had mentioned, a lot of these enrollment assisters within the ITU system, they're within the facility. They have information about the individual, and a lot of times these enrollment assisters know their community so well. They will know them by name. They will know them what family they're coming from. They might be able to also help in other aspects as well too. But there are also navigators. Way back in the day when the CAT first came about, which is a certified application counselor, then you could also become a navigator as well too. There's also agents and brokers that are available. Next slide. And then here's the Certified Application Counselor Designation Organization Program. And I'm sure you guys probably saw a lot of this going out, a lot of notification around this, and hopefully we get more of our ITU facilities to be able to apply for the CDO program. And this helps with also a back door, which means that you'll be able to get someone faster, get assisted faster. That's usually one of the biggest benefits to becoming a CDO. So next slide. And then here are some marketplace information that you guys can go to and just maybe go on, sometimes they put information on Twitter, Facebook, and YouTube. Next slide. And then some more helpful information as well to the Magi, which is something that we always look at when we're looking at Indian income, cost sharing reduction brochures. These are all good things to have on hand. And you can always order as many as you want from CMS Division of Travel Affairs. Next slide. Oh, next slide. Oh, you can keep you can keep entering there. So these are just all websites directly from the CMS, and we all deal with each one of the programs. So next slide. And that is my contact information.
Great. Thank you so much for all of this information. Again, we will be sharing these slides out at a later date in about a week. And so all of these resources will be shared with you. On that note, I'd love to open it up. If anybody has any questions for Kristen, I do see that there is one in the chat already from Tina Escobar. We are an IHS facility and asked CMS Marketplace in the past about being a CDO. They indicated that because we are a federal organization, we did not need that designation. Has this changed? Oh, I think you're on mute, Kristen.
I forgot I put myself on mute. So I'm not exactly sure, Tina, why that would be the case. It's never been that case at all. I know that every time I talk with CSIO, we are always trying to figure out why a lot of our IHS and our tribal facilities are not a CDO. And so, but yes, you can apply and become a CDO as well too, whether you're a federal organization or not. This is a good way to be able to get that back door as well too, and to get a little bit more assistance when it comes to the CDO side. But yeah, you're eligible to apply for it, whether you're federal or not.
Great. Any other questions? Feel free to put them in the chat, or you can take yourself off mute.
I know that the marketplace is a very huge topic. And then sometimes I just did the bare basic on this, and I usually do trainings on this, and it takes more than an hour. And I'd be willing to, if you tell me exactly what you guys are going through, or what kind of challenges, or what kind of questions, or, sometimes it's case by case as well too, when it comes to any of the CMS programs. And you want to ask more questions in that, or maybe you think that, oh, well, our facility could, learn a little bit more about this. And of course, we also have changes in staff that happens as well too. So I'm totally always good at being able to do training as well too separately.
Kristen, what have you seen as some best practices for UIO or facility to promote, to continuously promote marketplace enrollment and engage, engaged audience as well?
Yeah, UIOs are pretty awesome when it comes, because there's, I guess for UIOs, you're flexible and doing a lot more grants. You're able to also reach out more into the community. And I've seen a lot of good outreaching happening, meaning that you are also able to reach out to other partners within your area as well too. Maybe even in the next city, you're also reaching out. Like I said, you will have American Indians and Alaskan Natives from all over Indian country. You might not just have, Navajos and Hopis in one area. You might get the Cheyennes. You might end up getting the Crows as well too. So there's always a mixture for the UIOs that you deal with a lot more American Indians and Alaskan Natives as well too. So, but I've seen a lot of good brochures. Social media is a big one in UIOs, and all the outreaching is pretty amazing. You outreach to not just other organizations that do the same work, but you're also looking at where individuals go, whether it's the mall, whether if it's the school, whether if it's maybe even those that work in the private hospitals as well too. So I've seen a lot of amazing good work happening in the UIO side. What is, okay, I see another question here.
Yeah, I'll read it. So can you include HMO and PPO insurance in your presentation? The IHS facility I work at is not in network with any plan that requires patients to establish PCP with their health plan and coordinating their care within their plan's network.
Oh, absolutely. Yeah. So you're absolutely right, Dina. HMOs and PPOs, it's extremely important to know the difference between those two. And especially when those that are working on the IHS side or the tribal side. And if you work in those two facilities, it's very difficult to contract with some of the health and insurance marketplace plans. A lot of times you would have to choose the PPO plan in order to refer patients out. But that also doesn't take care of those that get seen at those two facilities. On the urban side of it, it's a little bit different. You know, you guys are able to contract a little bit more. Like I said, that flexibility is there, so you're able to refer out more, and it just depends on what the individual wants. If they want the HMO or the PPO plan, I'd say on the UIO side of it, it's not a huge burden as it is for the IHS and the tribal side. But good question, Tina.
Great, thanks for that. Any other questions? Feel free to drop them in the chat or come off of mute. Great, well, if we don't have any more questions, we'll move on. So next slide, please. Great, and again, we'd like to thank Kristen for sharing her time and also resources today, and also her contact information for future questions or trainings. With that, we have a survey here. If you have a smartphone, you can take a shot of the QR code. If not, there is a link here, which we will also drop into the chat. But we generally appreciate your time and effort to help us shape future events. So by filling out this brief survey, it'll help us to, inform our events for upcoming events. I'll give everyone a minute. And we'll go on to our next slide, please. And we just wanted to share some internal events that we have going on for the month of September. On September 26th, we are launching an HIV toolkit, HIV/AIDS resource guide. So please join us September 26th at 2 p.m. for that. And on September 28th, we are going to be kicking off our behavioral health community of learning series with the first session. The overall topic of the community of learning is strengthening wellness in Indigenous communities using the medicine wheel, with the first session being on utilizing culture in grant writing and programming. All of our events can be found on our website, and we will drop a chat of our events webpage as well in the chat. And we have more events coming up throughout this fall as well. So please check back on NCUE's website. And last slide, please. Great, so we just wanted to thank all of you for sharing your time with us today and your questions, and especially a big warm thank you to Kristen again for joining us and sharing her expertise. I know it was really valuable and knowledgeable information for our audience today. So thanks everyone, we'll conclude this session and we look forward to having you join us in a future event. Have a great day.